procedure to a patient, you have to read the patient's order. Of course, do the 12 sequence. One of it is getting the patient's data. Then you read the diagnosis of the patient, and of course, very important, you have to understand or interpret the doctor's order. So I've read it to you already. So the doctor's order is to insert PNSS 1 liter. So this is the, so I just make it in this one. 0.9 sodium chloride 1 liter. So it comes in 1 liter. So one preparation only also is 500 cc only, carrying 1000 cc. So I've read the doctor's order, so it is the 0.9 sodium chloride. And then we have to check the, what are you going to check here? The ordered pyridate, in the presence of what? Any discoloration, presence of any sediment, and then also check the integrity. If it is closed, of course, we have to turn it upside down and check for any leaking, no? Kasi na leaking. And in opening the sterile box, we need a Venoclysis, of course. We also check again the expiry date, the integrity of the packaging. Also, what is the thing written here? Is it micro or macro? Okay, so it is the one we need. It is macro drip. Macro drip. This is micro. Kanila keklaro macro. Okay, macro drip. Macro. So macro is having a what? Inside the drug chamber is a macro drip. So what are the parts of the Venoclysis glass? This is the
Cup.
Okay, the cap. Inside the cap is the
Pursing device.
Okay. Or the spike. So you should maintain the sterility of this. What do you call this one? Airway valve. This one? Wings. The wings, no? And then we have here the drug chamber.
Drip chamber.
Is the macro. Macro is macro. There's no needle inside the kind of micro, no? And then this is of course the tube. And then this is the
Roller clamp.
roller clamp or the regulator. And this is the
Y side. Or injection port.
And then of course this one also, we should maintain the sterility, is the
Tip.
the hub or power lock.
Lower lock.
Okay. So there are different names but they are the same, no? Lain-lain nga author, lain-lain lang ipangalan, pero they're all the same. So of course, also you mentioned, for additional score, you always mention the cap or the cover, no? So additional score. Tapos para magkakapon yung score, the tube itself. You have to identify the tube itself. Okay, so I'm sure already of the doctor's order. It corresponds with the solution that I prepared. So, sterile glass. So, hold the hard part or the wings of the Venoclysis. Then you look for the hole. There's a hole here which is bigger and the two are smaller. The smaller holes are where we're going to inject the drug to be incorporated. But the bigger part or the hole is where we're going to spike it. So in spiking, you have to look for a hard board or stable board, then you twist. I did not hold it here, but rather in the hard ways, no? Twist down. And then I'm going to turn it upside down. Okay. If it is more than halfway the drug chamber, you have to turn it down. So it should only be half. And then I'm going to hang it in the, what you call this one? Hook. The hook. So if it is quite tall flat or low, you cannot twist it, you just do like that. I'm now going to prime. The tube or the Venoclysis. So this is what we call a priming. Open the, what you call it,
roller clamp.
Or regulator. You remove the air.
Regulator. Regulator or roller clamp.
So we have to remove the air from the filtration flask in order to avoid air emboli. Air emboli is one of the complications of venoclysis therapy. When you close it. Then after that, you replace the cap to maintain the sterility, and you just put it like this here. Okay? See it? I just hook it back. And then I'm now ready to do insertion. So I will not be teaching you well with the insertion because somebody will teach you this. So I just want to let you see that this is the metacarpal vein. And then when you turn it, metacarpal vein, here is the cephalic vein.
Cephalic vein.
And this is the bacillic vein.
Bacillic vein.
There are still other veins that IV fluid can be inserted. Okay, of course, when you insert it, the fingers should be facing you and then you hold like that. And then there's a tourniquet that you should put here. So what are the things that you are going to prepare during insertion class? One is
Cotton.
cotton. Two,
Needle.
needle cannula. Three, alcohol. Four,
Tourniquet.
tourniquet. Five,
Gloves.
gloves, skin
Plaster.
gloves. Six,
Plaster.
plaster. Seven, sterile pick-up forceps. Eight, tapos na. Tray. Oh, the small items to be placed in the tray for orderliness and scissors. And also, you always bring along with you a kidney basin as waste receptacle. Because when I prime, there's the water there. So, every item that you will not use anymore, you have to put immediately in the kidney basin to maintain the orderliness and cleanliness of the area. Okay? So, of course, IV tag. Okay. Which will be filled up after insertion. Okay, so of course, when you do the insertion, you have to have your cotton balls with alcohol. So, class, I've noticed though, when my students and caregiving or other students of mine is putting alcohol, they do like that. Which is a wrong practice. Wrong practice na siya ha. When you are in the area class, you should have a small cap or small container where you're going to put there the cotton balls and then you pour with alcohol. If in case you have no small cap, you can do like that, but this is not like doing like that. Too close, contaminating the opening of the alcohol. It should be away. Ha? It should be away. You do it away, dili nga na. Dili ipapilit. Just when you pour water in perennial care, dili ba ninyo i-touch? So it should be away, like that, no? Away. Ayaw away, okay? Then after that, of course, I'm wearing clean gloves only. So I have selected already an accessible vein, and a vein which is straight, and a vein that has no hair in the surrounding area, dili balbon. Tapos, there are no scars, there are no hematoma, no insect bites. Straight vein, straight, dili corrugated vein. Kanang tuyo-tuyo. And then, tourniquet there. When you're going to tie the tourniquet class, the tourniquet is not here. So, let's assume that this is a tourniquet. When you tie the tourniquet class, ayaw ninyo i-tie directly in the skin. Kaya nga naman, lalo na kung elderly and yung patient class, sigulang, loose na ba ya? Foreskin turgor na siya. Foreskin turgor meaning the skin of the elderly is no longer elastic. Gali na siya mukunot-kunot. Kaya imo gali ng hiktan, mupaak. So, dapat ang technique yan is like that. Oh. You put your fingers there. Dili direct sa skin, then you tie the tourniquet. Tie it. Dili direct sa skin. Then, when you already tied it, that's the time you so, nakaya na nimo, imo na dahil buhian. Dapat kani ang naka-direct sa skin. Kaya kung dili, again, mupaak na nila na. Because the elderly has foreskin turgor because it has no more collagen. Collagen and fat. Okay, nakaya na nako. So, I'm going now to insert my needle. So, again, check the packaging of the needle, no? So, How many seconds do I have to clean the insertion site class? How many seconds?
15.
Ako na lang kato. Ha?
15.
15 to
30.
30 seconds. So I will going to insert in the metacarpal vein. So circular motion, concentrate where you're going to insert, then you go out, then you put in the basin, and then you instruct the patient, ma'am, kindly make a fist. Make a fist like that. In order that, aside from the tourniquet keeping the vein stable or avoid in moving, the technique also of making a fist and you're holding the way you hold the patient's hand will also stabilize or dili mo lihok-lihok ang vein. Okay? So it is in the vein that you insert not in the blank. Artery. Yeah. Do not insert IV in an artery class. We are inserting IV in a vein. Okay, so I already checked the packaging, expiry date, and also the vein. So I'm going to pick this one. Okay, then we're going to remove the cap or the cover. Okay, so inside here there is still a steel needle, a metallic needle, and then on top of it is the catheter. So some will hold the needle like that with the insert. Some will hold the wing or the butterfly, no? So I prefer holding the wing or the butterfly. And then the bevel of the needle should always be facing you, class. Facing you. And then when you insert, you start with how many angle, class? Angle?
15.
15. Then after the 15, then you can feel the sound, or you cannot hear actually, but you can feel it. It will do like that. Look. You can feel the look. So you already hit the vein. So after that, after the 15, then nakaplok na, straight na dahil ka. You decrease it of 10, and then you parallel it up to the vein, no? So kung wala kay backflow, you check for the backflow, kung na may backflow. Kung wala, you have to search for the vein, then you do it straight. So this is quite difficult class because it's not made of the patient's skin, no? Very difficult to straight because it's not a skin, so it's quite hard. And then when you're already there, you push the catheter inside, and then you pull the metal, and then in order to avoid mess, naman ko'y mga dugo, mga bubuwa anak class, there should be an OS under, OS or gauze. You put a gauze there, gauze. Para kung na may blood spillage, it will not render the patient's skin dirty or bloody. Then after that, before removing the needle class, the metallic needle, inyong kuanan nyo, kadulan nyo, you're going to apply pressure para dili mo ang daghan dugo. So you apply pressure on top and then you remove the metal needle. Then remove. And then you're going to get this one. Remove the cap. Then you insert it. Okay. Then you tighten it. Of course, after that, we're going to open the ruler or the regulator. Okay? So, hinay lang siya. Ako na i-close kayo, magpasak-pasak ka. Okay. Ano siya. And then, before applying the plaster, you're going to remove this one and then apply plaster. So, if your patient is pediatric, elderly, incoherent, restless, you have to apply what class? What are you going to apply to stabilize to stabilize the needle? What are you going to apply, class? Pasyente ninyo, geriatric or elderly, restless, masama inyong i-plug. What do you call it? We call it a splint. Okay, splint to immobilize the vein. Or immobilize the arm.
Namurag kuan matabla.
So So I put 2 cluster there. We are going to stabilize the wings or the butterfly. I-flat ninyo class ang butterfly sa para stable. Flat. Then you apply cluster. As if you're making a letter U. Okay? So 2 cluster there, then I flatten the wings. Then flatten the wings. And then this one class, to avoid accidental pulling of the tube, you can entwine there, no? To be safe. Or whatever is convenient, like that. Then you reinforce with another cluster. Reinforce it. Okay. So there's another technique class in insertion. After they have hit the vein, there is some kind of a connector we're going to splash or flash with distilled water. So kita na-insert na nila, di saan na nila i-connect. Na sila i-connector and then they're going to get a sterile water. Ready na ang sterile water ha. Tapos ilasang i-flash before they're going to connect the Venoclysis. That's another technique. To ensure na talaga naa sila sa vein. Sigurado na naa sila sa ugat. Okay? That's it.
Baklo ba yung dugo?
O, mubaklo ang dugo. Class, what is the indication that you hit a vein? Once you puncture the vein, what I told you, dahil yung na-feel na floop, na-feel din nyo, dahil mo kuwan. Tapos, another sign that you are in the vein, there is backflow of the blood. Backflow. So, the